To provide effective care, care professionals need to be equipped with the right skills and knowledge to support clients and their caregivers meaningfully. There are a few guiding principles when engaging your clients. Approach with care and respect. Always introduce yourself and communicate at eye level. Validate their feelings and try to understand their lifestyle and their preferences. Try to also look at situations from their point of view. Besides these, there are various principles on person-centered care which you may adopt. This video looks at 3 common scenarios to offer quick tips on how you can manage challenging situations like engaging resistant clients. When giving advice to clients and caregivers, it's important to first listen carefully and empathize with their situation. Some of us may make the mistake of jumping to judgments, conclusions, and advice giving too quickly.
Calling, there's somebody at the door. Hi, Anwar.
Hi, Wendy. How's everything at home?
You see, I'm very busy, right?
Your father has dementia, so you could expect that from him.
You stayed with somebody with dementia before?
Nope, but I've worked with a lot of them.
Then you don't understand one. You know, very frustrating, you know. He keeps calling me.
Yeah, but with your father having dementia, I think you can expect that. Maybe how about this? I'll share with you a list of activities. Maybe you can get a father to...
Can you just send me the list?
Sure. I'll send it to you via email, then I'll check in you again.
Okay. Bye.
Okay, bye.
Before starting a session with a caregiver, try to make the caregiver feel as calm and as comfortable as possible. Empathize with the caregiver and avoid judgment or jumping to conclusions. You may involve the caregiver in the problem solving so that the tips shared are relevant to them. Always request for permission before giving advice and ask for their thoughts on your suggestions.
Can you wait or not? There's somebody at the door. Hi, Anwar.
Hey, Wendy, how's everything at home?
Very frustrating. My father keep calling me.
That sounds really frustrating, Wendy. Okay, how about this? Maybe if you got time, I can come in and we'll talk things out. How about that?
Can. Come in.
Okay. Hello, Uncle Ho. How are you doing today? Have you had your breakfast?
Hello.
So, what did you have for breakfast just now?
I can't remember.
It's okay, Uncle Ho. Anyway, Wendy and I will be having a bit of a chit chat. If you need anything, you can just let us know. We'll be over there. Okay? Hi, Wendy. Hi. So, how you were mentioning to me earlier that you're frustrated with your father?
Yeah lah, you see, every 10 minutes he keep calling me.
You could share a bit more because I would like to understand. What are the daily routines that your father go through?
So every day I let him read newspaper. Then other than that, I organize some activities for him. But then very tiring, you know. I need to keep thinking of what to do for him.
When you think about it, if you're doing too much, I'm scared that you're gonna get burnt out.
What to do?
Oh, maybe what we can do is I can share with you a list of activities that can be tailored and customized to your father. But could you share a bit more on his past hobbies as well?
He used to love fishing. Yeah, and then he also like to do puzzle.
I see, okay. These days, right, because of digital technology, what we can do is we can download all the game apps like fishing and puzzle as well.
That sounds good.
Yeah.
Pa, tell you lunchtime not yet. You see? Repeat 5 times already.
Yeah. Actually, the other caregivers, what they tend to do is they have this big sign, right, as a visual reminder for their parent with dementia to tell them that, hey, it's lunchtime now, so the parent will not keep on asking.
Wow, that sounds good.
Yeah.
I'll try that.
Yeah, so, maybe I can share with you the list of activities and see whether you can use it.
That would be great. You can send me the list?
Yep, sure.
Here are a few tips for caregivers to set boundaries with their loved ones. Look for a reason behind the repetitive behavior. Does it occur around certain people or surroundings or at a certain time of the day? Is the person trying to communicate something? Focus on the emotion, not the behavior. Rather than reacting to what the person is doing, think about how he or she is feeling. Give the person the answer that he or she is looking for, even if you have to repeat it several times. Provide structure and engage the person in pleasant activities. Use memory aids, offer reminders with notes, clocks, calendars, or photographs. Accept the behavior and work with it. We hope you found this case scenario useful. In the next scenario, you can explore tips on how to engage clients who show resistance to participating in activities. With the right approach, care professionals can be effective in supporting clients to engage in meaningful activities. In this scenario, we will share tips on how you can respond to clients who show resistance to participating in activities. When introduced into a new or unfamiliar environment like a care center, clients often express the desire to go home and may refuse to participate in activities which are planned for them. This usually happens before the client has formed friendships and settled into a comfortable routine at the center.
Good morning, Mr. Lim.
If you're here, I'll come back for you tonight.
Where are you going?
I'm going to work. Okay, bye-bye.
Your daughter is going to work. So I'll move you there.
Where's my daughter? I want to go home.
Your daughter will come back in the evening.
I don't like it here. It's so noisy.
It's okay, now you start coloring.
I don't
color
know how. I don't know how to do it.
I'm busy, I'll come back later. Now you start coloring.
No. What did you say? I can't hear you. What? Color what? I don't know. I want to go home.
Haven't you finished coloring yet, Mr. Lim?
I want to go home.
We'll go home in the evening, 6 o'clock. Your daughter will come to pick you up. Don't be difficult. Now you play bingo. Here's the bingo.
When a client expresses the desire to go home, they are telling you that they are tense, anxious, scared, or in need of extra comfort. It's important to acknowledge their feelings and uncover the underlying stresses that they are experiencing. Reassure them that they are in a safe and supportive environment.
Go first,
Where are you going?
I'm going to work. I'll see you later. Bye-bye.
Hello, Mr. Lim. Good morning. How are you? Your daughter will be back soon, don't worry. We have a lot of games for you as usual. Are you okay?
Where's my daughter? I want to go home.
She'll come in the evening.
I don't like it here. It's so noisy.
How about coloring? Which picture do you like here?
I don't know. I don't know how.
It's okay, Mr. Lim. She'll come back in the evening. She'll come back soon. Now let's do some coloring. So you can pick the color from here and let's color. Which color do you like? Yeah, now you start coloring. Is the music loud for you? Okay, I'll go lower the volume. Can you start coloring? By then I'll come back. Wow, Mr. Lim, you've done a beautiful job. Wow, so beautiful.
I like coffee shop.
Oh, which coffee shop did you go to?
The one near my place.
Where is that?
Tiong Bahru, you know.
Mr. Lim, tell me more about the coffee shop. Tell me more.
I like the food there.
Here are a few tips to engage clients who are resistant to activities. Understand their needs. Try to establish the cause of their anxiety and address those concerns. Respond in a calm and positive manner to help them feel understood and supported. Avoid arguing. Go along with their logic. Your reality is often different from their reality. Contradicting them makes them feel agitated and not heard. Validate the emotions they are trying to express. Repeat and concur with their statements. Ask about the client's home to show interest. Subtly, try to redirect their attention with a drink or a snack and introduce an activity which is meaningful to the person. As far as possible, give them the autonomy to choose how they would like to do each activity. If the person needs help, do the activity together with the person while providing step-by-step guidance. Encourage the sharing of positive memories. This helps to calm the person down and support the person's sense of identity. Remember, the activity is merely the means to an end. Completing the task is secondary to maintaining the relationship between the care staff and the client. We should focus on getting to know the person through the activity with the ultimate goal of enhancing the person's well-being. Most importantly, see the person as who they are, beyond the medical condition. We've come to the end of the second scenario. In the final scenario, you can pick up tips on how to assist clients who are resistant to taking medications. In the previous two scenarios, we've shared some tips that care professionals can use while working with clients. In this final segment, we will look at another commonly encountered situation. Getting someone to take their medicine can be an ongoing challenge for many caregivers. Refusal to take medication could be an indication of fear or confusion. However, this behavior is often interpreted as being stubborn or a deliberate act of making things difficult.
Hello, Mr. Tan. How are you today?
I'm okay.
You look a bit pale. Can I check your blood pressure? Mr. Tan, your reading seems to be on the high side. Have you been taking your medication regularly?
Yes.
Are you sure? Can you show me your medicine box? Alright. You have not taken your medicine today. Come, I help you to take now.
I'll take later.
Come on, I help you, Mr. Tan.
No,
Mr. Tan, you are sick. That's why you need to take this medicine.
I'm not sick.
Don't be difficult. Come, it's just a
No.
few tablets only.
No, I don't want to take.
It will help you. Come
No,
on.
no.
I help you. Come.
No, I don't want to take.
Mr. Tan, don't be stubborn. I'm here to help you.
Get out!
It's essential to build trust and rapport with the client before any intervention can be effective. Use clear and simple words and always speak in a respectful and reassuring tone. Instead of forcing our ideas on them, we can try to understand their underlying concerns and come up with creative solutions to overcome these barriers to change.
Mr. Tan, how are you today?
I'm okay.
You look pale. Can I check your blood pressure for you?
Okay.
Mr. Tan, your blood pressure shows on the high side. Have you been taking your medicine regularly?
Yes.
Can I take a look at your medicine box?
Okay.
We have not taken your medicine for today. Can I help you to take your medicine?
No, actually I can move well on my own. I don't need to take medicine.
Mr. Tan, do you know what will happen to someone if the blood pressure always high?
What? Can mati ah?
Not mati. It's just that, your blood pressure consistently high can lead to complications like heart attack and stroke.
Stroke ah?
Yes, that's why taking the medicine will help you to reduce your blood pressure and reduce the risk of getting these complications.
But I have so many medications. I'm so afraid. The side effect.
Okay. This is a very valid concern. Okay, when you see the doctor at your next appointment, you can share your concern with the doctor. But for now, to keep your blood pressure in check, you need to take the medicine.
I can't remember when to take them. There's so many medications.
Okay, why not I help you to write a note and paste it on your medicine box so that can help you remember to take in the morning?
Okay.
Okay, I will paste it like that so that every morning you see the notepad, you will be remembered to eat the medicine. What do you think?
Put there. Yeah.
Here are a few tips on responding to resistance to taking medication. Avoid accusatory statements and asking why, such as, "Why are you so stubborn?" and "Don't lie to me." Acknowledge the client's concerns. Respecting how they feel builds trust and rapport. Explore barriers to change. Look out for root causes, perhaps an unpleasant experience with medication or a fear of side effects. Bridge the knowledge gap if the client lacks an understanding of the medications and their purposes. Customize responses to suit the client's needs. If the client tends to forget when to take the medication, offer solutions to remind them. If the client still refuses to take medication, try asking the doctor to change the medication to syrup and mix it into food or drink. We hope the 3 case scenarios have provided useful tips that you can apply when working with clients in challenging situations. By adopting a person-centered care approach and respecting the person living with dementia, you'll be able to effectively engage, empower, and support them.